Hey, Dr. Josh Bletzinger here. Real excited to bring you a three-part series in breast cancer prevention. So in the spirit of the Breast Cancer Awareness Month, I wanted to dive into some of my archives in functional medicine, and through my studies of my functional medicine certification, I wanted to create this three-part series to help my community, my family, my loved ones understand a little bit more of what we can do to help prevent cancer, as well as live in a lifestyle that is going to produce wellness and be a part of the movement that is going to make sure that cancer is a less of a risk factor through our adult lives, even our young lives, than it is now. We're living in a day and an age where the modifiable risk factors that we're experiencing are, we can make those changes. And so that's what I did. I put this three-part series together, and I want to dive into this with you. This three-part series together to help you understand, number one, the risk factors. Number two, we're going to, in a successive video here, we're going to start to create some natural anti-breast cancer strategies, as well as the third one here is give you some nutritional supplementation pearls and understand some of the materials that work really good for different aspects of our body function and why. So if we can focus on the risk factors today, we're going to do just that and get through some of these more prevalent risk factors that seem to be more noteworthy through the materials that I've been able to access and get a better understanding of. And so really the initial disclaimer here is that I'm not here to, I don't treat cancer. I don't create treatment programs to help people reduce or get rid of cancer by natural means. That's not what I'm here for. I want to help support body system function, and we're going to look for, just like our functional medicine model, we're going to be looking for root cause resolution to disrupted or abnormal body function. And what we're going to get into here is we see these three different factors here by identifying risk factors. First and foremost here in the orange, these are risk factors that are a little bit more genetic and inherently dispositioned here. So we're looking at the BRCA gene, and we're looking at early menses. And so when we look at statistics for early menses, so menarche before the age of 12 or 11, just depends on the study they're looking for. So, menstrual cycles that start in females before that age are demonstrating an increased risk to breast cancer later on in their years. Higher bone mass density. Now this is interesting because in studies it holds true for studies that have identified increased bone mass in the lumbar spine, but not in the femur or other skeletal factors. So this uptake of estrogen into the bone to help build up bone as a hormone is correlated with breast cancer and is a risk factor for breast cancer. And then last one that I'll touch on here at the bottom of this is melanocyte nevi. So we'll look at some skin indications. But what I really want to concentrate and dive in on here are these ones in purple here. So we're going to look primarily at body compositions. That's really going to set up how we're going to do video number 2 and ultimately video number 3. Alcohol use, inactive lifestyle, and cigarette smoking, and these are major lifestyle factors that are pinned to the highest risk factors for developing breast cancer. The last ones here on this list are toxicity, so toxic exposure, the inability to get rid of these toxins, as well as oral contraceptive pills and hormone replacement therapy. So we're going to talk a little bit about that. So moving into body composition. So body composition, we're talking about body composition, we're talking about overweight and obesity, right? And it's not a fun subject to talk about, but we have a high percentage of people in the United States that are considered obese or overweight. And there's a lot of different ways to measure this. For our purposes, we look at body mass index. We don't look so much at weight as we do body mass index and other body composition factors that would give us the indication for overweightness or obesity. And we have these statistics that are pinned to this. So 1 in 6 cancer deaths in the U.S. are attributed to overweight and obesity. And the same thing is approximately 20% of all cancer cases are related to obesity and weight gain. And so when we look at that, if we are going to construct the perfect body for cancer to breed in, right? If we are going to make the perfect body for cancer to develop and proliferate in, we are going to be looking at an inflamed and overweight body. All right. And the interesting thing here is that, you know, you get a lot of people that are extremely frustrated. They're working on this. They're working on trying to reduce their weight, improve their body composition, purge those the BMI, get those reduced, and they have a very unsuccessful strategy that that doesn't allow them to achieve the goals that they're looking for. So there are a lot of people that continue to try to lose weight, but they just can't lose weight. And what we're going to go through in video number 2 is the reasons for that, because weight gain and obesity is a symptom of a deeper issue. And so in functional medicine, we're getting to those deeper issues and not just doing the exercise more, eat less strategy, or these fad diets that they just leave you in the same position that you were. So stay tuned for that one. I don't want to get into that now. I just want to unpack the highest risk factors here. So when we're looking at still at body composition, overweight more than doubles the risk for dying of breast cancer. And the same holds true for underweight too. So if we were looking at a BMI through studies of less than 18.5, in BMI, that's going to also increase the risk of breast cancer recurrence. So we're going to be looking for that happy place of BMI, and we will get into that in video 2. So now just some other statistical factors here. We're looking at obesity in young estrogen-rich positive BRCA gene patients, and through 70 clinical trials here with over 80,000 early stage breast cancer patients, the obesity, so in a BMI greater than 30, so we're looking at that, increase the risk from dying from breast cancer by 34% in premenopausal women, okay? And so this is with estrogen-rich positive tumors. In other words, so if you look at down here what's going on in the 10-year breast cancer mortality for premenopausal women with ER-positive disease, it was 21.5%. compared to those that were non-obese at 16.6. So the intervention alone of decreasing body mass index, decreasing weight, getting out of that obesity category is going to reduce the risk of over 5%, and that is statistically huge, okay, as one of the #1 risk factors. The next one here then holds true with postmenopausal estrogen-rich positive disease, has a 6% increase of risk of dying from their breast cancer, okay, if they are obese. So we know positively, primarily, that reducing body mass index, reducing that label of obesity and overweight is going to reduce your risk significantly in one of the primary risk factors for breast cancer. And that is one thing that we are going to go and have some fun with in video number 2. Number 2, alcohol use. So there is no risk-free level of alcohol consumption. So all levels of alcohol consumption pose some sort of a risk, especially in the world of developing cancer, as you can see here. More a person drinks, the higher the risk for cancers. And it's not just limited to breast cancer, but you can see all the other body systems and body organs that can be susceptible to cancer because of the increased alcohol use. So even light alcohol use it creates an increased risk. Now, when we look at this, okay, women who drink between 1 and 2 alcoholic drinks per day increase their relative risk of breast cancer by 10% compared to light drinkers. 1 drink per day raises a 50-year-old woman's 5-year absolute BRCA risk from 3% to 3.45%. So there is an increased risk. The risk of breast cancer increases by 30% in those who have more than 3 drinks a day, and that's the same risk as hormone replacement therapy, and it's the same risk as smoking 1 pack of cigarettes per day, okay? And so for some people this will hit home, and for others you have to create intervention strategies and create other lifestyle strategies that are going to help us reduce the amount of alcohol consumption, because this is a high risk for the development of cancer. And it does not matter what kind of alcohol we're consuming, and it doesn't matter what ethnicity we are as a human being. This is affecting everyone equally, okay? So alcohol is number 2. Number 3, an inactive lifestyle. So being sedentary is going to increase the risk of breast cancer by statistically 10%. So, and this is saying the prevalence of inactivity. So almost 40% of our population is inactive. And this is a meta-analysis, so this is a wide range of studies that's collected to make a stronger scientific evidence on this. And so in video 2, we're going to be going heavy into creating an active lifestyle, because we know that diet and lifestyle are the major preventative risks for decreasing our health challenges as we move through our years. And that's what we want to focus on. Cigarette smoke is the last one. We know that these are estrogen-forming carcinogenics. They affect our DNA, and if they bind to our DNA, they're going to create mutations within the cell, and mutations in the cell become replicable in our body, and this, we already know that cigarette smoking is extremely harmful to our health, and that is a lifestyle choice, and that's why we want to make sure that we're including this in our lifestyle risk factor to start to make awareness of it and create even more intervention than is going on now, so we can eliminate cigarette smoking as a risk factor to breast cancer and all cancers for that matter. One thing that I really like to work on is toxins, and so when we look at the major toxins that are associated with cancer, especially breast cancer, are these that are listed here, because they are primarily what you call endocrine disruptors. And so if we're disrupting the endocrine system, we're disrupting our hormone function. These are very estrogenic, developing toxicity materials, right, that will create this abundance of disruption within our hormonal system and disrupt the functionality of what our female hormones are supposed to be doing. So estrogen, progesterone, to name a few. So you're looking at these polychlorinated biphenyls, the DDT, which has some really interesting findings behind it, that the effects of DDT exposed even in early years disruption throughout that time, and because you just don't walk through a door and get cancer. Like, the mutation has to develop in the replication of these abnormal cells, and the breakdown of the cell machinery has to happen over a period of years. Dioxins, which are found throughout our environment, they're heavily involved in pesticides, benzenes, and BPA, so other plastics and materials that are used to make pesticides and plastics and dyes, and they're found in our food and they store in our fat. So these toxins have to be just ruthlessly purged from our body, and we have to have a strategy to be able to do that. As you can see, I'm ridiculously passionate about being able to detoxify, because we can reduce our toxic load, we can allow our body to attend to other things in our body. And so we'll talk a lot about detoxification, especially in being able to reduce our body weight, our body mass index, get out of that obesity category. So we'll talk in depth about toxic exposure and toxic reduction in our body. And so then that moves us into oral contraceptive pills and hormone replacement therapy. So there's large studies, there's an abundance amount of studies out there that are pinning the use of oral contraceptive pills to an increased risk of relative breast cancer. And it's the same thing with hormone replacement therapy, that it is even higher than previously thought, as far as what that hormone replacement therapy is directly related and a direct cause to cancer. They're saying 1 in 50 women of average weight, not even obesity, of average weight, are going to get breast cancer as a result of hormone replacement therapy, and that this continues at some level. So once we even stop, this continues at some level for 10 or more years after the women stop hormone replacement therapy. So HRT, so hormone replacement therapy, and oral contraceptive use is something that I think is a major discussion with your prescribing doctor on the risks versus the benefits of why to use these materials, and when and if you're going to use these materials in your life at some point. So again, this isn't my world of being able to to get you off or tell you what's right and what's wrong. This is for your prescribing doctor to jump into that. Nonetheless, it is a risk factor. And then the last one here is melanocyte nevi. Now, melanocyte nevi are these little melanocytes developed on your body, and in this study we're showing that premenopausal women with 15 or more of these greater than 3 millimeters in size on one arm are 35% more likely to be diagnosed with breast cancer than women who have no nevi. And so this is an interesting one because this is a physical marker that you can keep an eye on if you're looking around on your body and your arms to see if you have a development of these melanocytes on one arm versus the other that are bigger than 3 millimeters. So ultimately, my job here is I want to educate you. I want to be part of the spirit of this month. I want to get great information out there, things that I've seen throughout my studies that are certainly helping and making a difference in other communities, and to be a resource and a guide for those that are looking to take preventative measures as well as help change their lifestyles for the better. And so if I can answer any questions for you, by all means, reach out and ask the questions that you need. And I want you to tune into the next video because that's going to be even a lot more fun than this one when we get into the strategies, the preventative strategies in video 2. So with that, I look forward to seeing you with the next video, and I will talk to you soon.